Imagine undergoing this really painful, invasive laser treatment to fix severe intimate dryness. You think it's going to help, but instead you discover the laser actually created a barricade of scar tissue.
Oh, wow.
Yeah, making the pain so much worse. So today, we're looking at a silent epidemic that affects, well, over half of postmenopausal women. And we're diving into why the medical community is sort of turning away from those energy-based lasers and looking toward the DNA of trout.
I know it sounds completely counterintuitive at first glance, right? Like
Sure.
fish DNA.
Exactly.
But there's a massive shift happening right now in regenerative medicine. We are evaluating this non-hormonal tissue rebuilding treatment called intimate polynucleotides. We really want to see if it can actually cure severe vaginal dryness without the risks that, come with traditional hormone therapies or ablative lasers.
Right. And for our mission today, we're looking at a really fascinating stack of sources to figure this out. We've got clinical studies from real-world case series, like the 2022 Alessandri study and the 2023 Criscuolo study. Plus, we are looking at the British Menopause Society guidelines, the NICE interventional procedure overview, and a bunch of clinic data.
It's a lot of ground to cover, but it's so important for anyone dealing with it.
It really is. Okay, let's unpack this. Because for decades, the medical approach to this kind of intimate discomfort has basically been either a temporary Band-Aid or like a sledgehammer.
Yeah, that's a good way to put it.
And to understand why we are now talking about injecting or applying fish DNA to human tissue, we really need to look at the physiological reality of the problem itself.
Right, the condition the medical community calls vulvovaginal atrophy, or VVA, which actually sits under a wider umbrella known as the Genitourinary Syndrome of Menopause, or GSM.
So what exactly is happening in the body to cause this?
Well, the primary driver behind this entire syndrome is the withdrawal of estrogen. Estrogen isn't just a reproductive hormone, It is the fundamental fuel that keeps vaginal and urinary tract tissues thick, elastic, and highly vascularized.
So it's feeding the tissue.
Exactly. It tells the body to maintain a robust supply of blood flow to that specific area. But when estrogen levels drop off, whether that is due to natural menopause or, say, surgical removal of the ovaries, or even certain systemic medications.
The local tissue just undergoes this dramatic transformation, right?
It really does. The structural degradation is intense. You see a massive drop in the production of subepithelial collagen and elastin. The tissue literally just starves and thins out.
And one of the most significant changes, from what the sources describe, is the flattening of what are called the vaginal rugae.
Yes, the rugae are essential. They are the natural corrugated folds built into the vaginal wall. They exist so the tissue can expand, stretch, and compress comfortably without tearing.
So without estrogen fueling that underlying collagen, those folds just flatten out completely.
They do. And you are left with a mucosal lining that is incredibly thin, fragile, and super prone to micro tears. Yeah. The resulting symptoms for the patient are severe dryness, chronic burning, itching, and a condition called dyspareunia, which is just the medical term for pain during sexual intercourse.
I mean, think of the vaginal wall like an accordion. An accordion functions beautifully because of those deep, flexible leather folds. But if the leather of that accordion completely dries out, becomes stiff, and loses those built-in creases, trying to pull it apart or push it together is going to cause the material to crack.
That's a really great analogy.
Right. Any kind of movement or friction becomes incredibly painful. And I want to emphasize to you listening, this is not just a minor passing discomfort or a slight dryness.
Not at all.
The clinical data tracking these symptoms shows that it fundamentally derails a woman's quality of life. It impacts self-confidence, daily comfort, sexual intimacy. Many women end up avoiding intercourse entirely because the friction on that thinned-out tissue is just agonizing.
It completely alters how women live their daily lives. So how has the medical establishment historically handled a problem of this magnitude?
Well, for a long time, the standard of care has been divided into two very basic tiers, right?
Yes. The first-line recommendation from doctors is almost always non-hormonal over-the-counter lubricants and moisturizers.
But hold on, if I can just go to the pharmacy and buy an over-the-counter moisturizer or get a prescription estrogen cream from my doctor, why are we resorting to fish DNA? I mean, it sounds like we're reinventing the wheel to solve a problem that already has a simple pharmacy solution.
This raises an important question, and it's one a lot of people ask. The reality is, for a massive portion of the population, those traditional solutions either don't work or they are entirely off the table.
Really? Why?
Let's look at the moisturizers first. An over-the-counter lubricant is essentially just a temporary surface treatment. It's a messy Band-Aid. It provides a slip for a few hours, but it does absolutely nothing to heal or rebuild the underlying degraded tissue.
It's like putting water on a cracked sidewalk and expecting the concrete to heal.
Precisely. You're just wetting the surface. Now, the second tier is topical estrogen, like creams or rings inserted directly into the tissue to locally replace the missing hormone.
And that works, doesn't it?
It can be highly effective at thickening the epithelium and restoring the natural pH. But, and this is a huge but, there are millions of women who simply cannot use it.
Like breast cancer survivors, according to the sources.
Exactly. They are frequently advised against using any estrogen-based products, even localized topical ones, because their specific cancers might be hormone receptor positive. Introducing estrogen back into their system carries an unacceptable risk of feeding any remaining cancer cells.
That makes total sense. If you have a history of a hormone-driven cancer, you definitely do not want to be playing around with hormone replacement therapy.
Right. And beyond that, a lot of women simply prefer to avoid hormones due to other side effects or just their personal health histories.
So you have this enormous gap in care. Millions of women who are dealing with severe chronic pain, who need something far more structural than a temporary lubricant, but who literally cannot touch estrogen.
Exactly. And when medicine couldn't offer them a pharmaceutical solution, the industry pivoted to a technological one.
The energy device boom. Because over the last 10 to 15 years, we've seen this massive surge in the off-label use of FDA-cleared lasers for vaginal tissue rejuvenation.
Yes, we're talking about things like CO2 lasers, the Mona Lisa Touch, NuV, Vajazer, and erbium lasers like Femilift.
But the logic behind how these lasers attempt to fix the tissue is actually rooted entirely in trauma, isn't it?
It is. That's the fundamental mechanism of ablative technology. The laser is inserted into the vaginal canal, and it emits targeted pulses of light energy.
And what does that energy do?
It gets absorbed by the water inside the cells of the mucosal tissue. The water heats up so rapidly that the cells actually vaporize. You're basically creating a grid of hundreds of microscopic thermal burns all along the vaginal wall.
Which sounds incredibly counterproductive. If the tissue is already fragile and painful, why would you purposefully burn it?
Because of the body's emergency response system. When the body detects those micro-injuries, it panics. It triggers a massive acute inflammatory cascade, rushing blood, nutrients, and immune cells to the site of the burn.
Okay, I see.
More importantly, this trauma stimulates the local fibroblasts. Fibroblasts are the cellular factories that produce collagen and elastin.
So by injuring the tissue, the laser forces these fibroblasts into overdrive.
Yes, resulting in the formation of fresh new collagen, a process called neocollagenesis. The goal is that once the microscopic burns heal, the resulting tissue will be thicker, highly vascularized, and better able to produce natural lubrication.
You're forcing regeneration through destruction. And to be fair to the technology, for a lot of women, this trauma-induced healing actually works. Clinical metrics tracking the vaginal health index show significant improvements for many patients.
They do. The results can be very positive for some.
But here's where it gets really interesting. The reliance on burning the tissue introduces a major unpredictable variable. We have to talk about the findings from the UK's health watchdog, the National Institute for Health and Care Excellence, or NICE.
Right, the NICE Interventional Procedure Overview.
Yeah, they conducted a major overview of the data on transvaginal laser therapy. And the safety profile they uncovered has some severe warnings.
It does. Because anytime you apply a thermal burn to human tissue, whether it's on your face or internally, there is a risk that the tissue will not regenerate cleanly.
Instead of forming healthy, elastic collagen, the body might form dense, inflexible scar tissue.
Yes, exactly.
There's one specific case study detailed in the clinical overviews that perfectly illustrates the danger here. They followed a 68-year-old woman who was suffering from severe intimate dryness and pain. She opted for the laser route and underwent 3 full courses of treatment.
And you'd hope she'd see improvement after 3 courses.
Right. But instead of the tissue regenerating and the pain subsiding, her condition deteriorated rapidly. When doctors finally examined her, they discovered that the thermal microinjuries hadn't triggered healthy collagen production at all.
Her body had responded to the burns by creating a fibrotic reaction.
Exactly. The laser treatments caused her fragile tissue to scar and contract, eventually forming a thick, crescent-shaped fibrous band right in the middle of her vaginal canal.
Creating a stricture, basically a partial physical obstruction.
Yes, her tissues were left completely pale, inelastic, and far more painful than before she even started the treatments.
And that highlights the critical flaw in the ablative model. It relies on the assumption that the patient's tissue has enough underlying vitality to survive the burn and rebuild stronger.
But if you are dealing with a postmenopausal patient whose tissue is already profoundly thin, starved of estrogen, and biologically exhausted,
Hitting it with a laser can overwhelm its healing capacity. It doesn't regenerate, it just scars.
which brings us directly to the paradigm shift we are looking at today. The medical community recognized this danger and started hunting for a way to stimulate those collagen-producing fibroblasts without having to burn, injure, or traumatize the tissue first.
Yeah. They needed a non-ablative, non-hormonal trigger.
And they found it in polynucleotides, the star of our deep dive.
It is a radically different approach to cellular repair.
Let's break down exactly what these are for you listening. Polynucleotides, or PNs, are highly purified fragments of DNA. And the source of this DNA is wild. They extract it from the gonads of male salmon and trout.
I know, it sounds like a bizarre homeopathic remedy. But the biochemistry behind it is incredibly sound.
How so?
What's fascinating here is that from a purely molecular standpoint, DNA is a universal language. The double helix structure of trout DNA is fundamentally the same as human DNA.
Oh, interesting. So it's compatible.
Very. Once it undergoes an extensive purification process to strip away any proteins or immune-triggering compounds, what you are left with is a highly concentrated polymer of nucleotides that is entirely biocompatible with human biology.
So we have this pure biocompatible DNA fragment, but how does putting fish DNA into human tissue actually cure severe dryness? It's not like the fish DNA is merging with our cells to make us part trout.
No, definitely not. It's about what happens as the body breaks those fragments down.
Right, the mechanism of action.
It relies on a natural process called enzymatic cleavage. When a polynucleotide gel is applied topically or injected into the vaginal mucosa, it doesn't just sit there like a traditional cosmetic filler.
It does something else.
Yeah, your body's natural enzymes, specifically nucleases, recognize these long DNA chains and slowly begin to metabolize them. They act like microscopic scissors, snipping the long chains into smaller and smaller pieces.
So they are chopping the DNA down into its most basic nitrogen precursors.
Exactly. As the enzymes cleave the bonds, they release individual nucleosides, nucleotides, and nitrogen bases directly into the surrounding extracellular matrix.
And why is that important?
This is the genius of the treatment. These precursors are the exact raw metabolic materials that your local fibroblasts need to function. You are passively replenishing the local cellular environment.
Feeding the cells.
Yes. The fibroblasts absorb these building blocks and use them to synthesize brand new collagen, elastin, and natural hyaluronic acid.
Okay, so if we go back to our earlier comparison, if energy lasers are like aggressively aerating your lawn, punching holes in the dirt and tearing up the roots to force the grass to grow back stronger out of sheer panic,
Right.
polynucleotides are like dropping millions of microscopic water-retaining seeds and a slow-release fertilizer directly into the soil. You aren't damaging a single blade of grass. You are simply giving the body the exact Lego blocks, the exact chemical nutrients it needs to naturally rebuild from the ground up.
That perfectly captures the shift in medical philosophy here. We are moving away from a destructive regenerative model, which carries the risk of scarring, to a purely supportive regenerative model. You are feeding the tissue rather than fighting it.
That sounds so much safer.
And the structural benefits don't just happen after the DNA is broken down. Even while the intact polynucleotide chains are sitting in the tissue waiting to be cleaved, they provide a massive benefit.
Because of how they structure themselves in a 3D gel, right?
Yes. In a fluid environment, these long DNA polymers organize themselves into a complex three-dimensional gel matrix. This matrix is highly hydrophilic, meaning it strongly attracts and binds to water molecules.
So it's hydrating the area immediately.
Exactly. So while the enzymes are slowly snipping away to feed the fibroblasts for long-term repair, the intact gel is acting as an immediate deep tissue moisturizer, retaining water and providing persistent relief from the friction.
Okay, the mechanism is elegant, fertilizing the cellular soil with biocompatible DNA blocks. But theory is one thing, and real human biology is another. When we look at the clinical data tracking women who actually use these polynucleotide treatments, do we see a genuine reversal of the atrophy?
We do. The clinical outcomes are remarkably consistent, regardless of the delivery method. For instance, let's look at the 2022 Alessandri study.
Right, the real-world case series by Franco Alessandri.
Yes, that data tracked the use of a topical gynecological cream containing polynucleotides, along with isosteryl lactate and glycerin. It showed incredibly rapid symptom relief.
How rapid are we talking?
Within just 2 weeks of daily application, over 60% of women reported significant symptom relief. Vaginal burning dropped by 72.5%, and vaginal dryness dropped by 71.4%.
Wow, so the mean overall VVA symptom score basically plummeted from like 2.51 down to 0.75.
Exactly. The relief was profound. But it gets even more compelling when doctors use a more targeted delivery system like vaginal ovules, which are essentially solid suppositories that dissolve internally.
This brings up the 2023 Criscuolo study using those ovules, right?
Yes, they used ovules containing 0.25% polynucleotides, sodium hyaluronate, and polycarbophyll. They tracked the actual physical thickness and structural integrity of the vaginal wall over time.
And this is where the restorative power of the treatment becomes undeniable. In tracking women who began the treatment with the most severe cases of atrophy, their tissues were dangerously thin, highly prone to bleeding, and almost entirely devoid of elasticity.
And the vast majority of those women, 91.1% to be exact, saw their condition improve to merely mild atrophy.
91.1%. That is a staggering detail. But the most notable outcome wasn't just an improvement. Over a third of the women with those incredibly severe cases, 35.6%, experienced a complete structural reversal. The medical literature refers to it as complete restitutio ad integrum.
Which means a total complete restoration to the original healthy condition of the tissue.
The tissue didn't just feel a little better with a bit more slip. Clinically, structurally, the tissue reversed in age. It rebuilt the collagen matrix, thickened the mucosal lining, and restored its natural resilience to the point where doctors could no longer detect any signs of the previous degradation.
It's a fundamental cellular repair, achieved entirely without the use of local estrogen.
And this is where this topic gets incredibly relevant for our younger listeners, because this profound thinning of the tissue is not exclusively a postmenopausal problem.
No, it absolutely isn't.
The clinical tracking explicitly highlights that these polynucleotide treatments are being successfully used on women in their 20s and 30s who are suffering from severe intimate dryness due to the side effects of their birth control.
It's a side effect that is rarely discussed, but incredibly common. When a younger woman takes a combined estroprogestin oral contraceptive or uses a hormone-releasing vaginal ring, the medication works by suppressing her body's natural hormonal fluctuations.
It tricks the body into thinking it doesn't need to produce its own cyclical estrogen spikes.
Right. But because estrogen is the fuel for that specific tissue's health, shutting down those natural systemic spikes starves the local environment.
Exactly. For many women, the birth control creates a localized, chemically induced state of menopause in the vaginal tissue. Systemically, the woman is healthy and young, but locally, her tissue is thinning out and losing elasticity just like a 65-year-old's would.
This leads to profound pain during intercourse, tearing, and chronic discomfort.
And historically, those younger women have been told they either have to just use a messy, over-the-counter lubricant every time they want to be intimate, or they have to abandon their preferred method of birth control entirely.
Which is incredibly frustrating.
But the data shows that introducing polynucleotides allows them to stay on their birth control while completely reversing the localized atrophy. The DNA fragments feed the starved fibroblasts directly, bypassing the need for an estrogen spike altogether.
If we connect this to the bigger picture, it restores a massive degree of bodily autonomy. And the efficacy of the treatment is often amplified by how it's formulated.
Like when they combine it with other things.
Yes, in many of the most successful clinical applications, whether via injectables or those ovules, the polynucleotides are combined with hyaluronic acid, or HA.
Which creates a fascinating biological synergy. You have two different molecules attacking the problem on two different timelines. The hyaluronic acid is the immediate rescue worker.
Right. It acts strictly to pull massive amounts of water into the tissue instantly.
Hydrating the environment, reducing the immediate friction, and making the patient comfortable within hours.
But hyaluronic acid is ultimately temporary. The body will process it and clear it away. That's where the polynucleotides come in as the long-term architect.
Doing the deep structural work.
Yes. While the HA is keeping the environment comfortable, The DNA fragments are slowly undergoing that enzymatic cleavage, quietly feeding the fibroblasts day after day, week after week.
So by the time the hyaluronic acid wears off, the fibroblasts have already synthesized a brand new permanent collagen network.
You get immediate symptomatic relief paired seamlessly with long-term structural repair.
So what does this all mean? When we synthesize this journey for you, looking at the totality of the clinical evidence, the answer to our initial question is clear. Yes, intimate polynucleotides are highly effective at treating severe vaginal dryness.
They truly are. They represent a non-hormonal, non-ablative, highly regenerative alternative to lasers and traditional HRT.
For women who cannot take hormone replacement therapy due to cancer risks, or for women whose tissue is simply too fragile to survive the burns of a laser treatment, this technology offers a way to rebuild from the ground up.
And this is why it matters. Whether you are prepping for menopause, dealing with birth control side effects, or simply want to understand the cutting edge of regenerative medicine, this represents a massive leap in female bodily autonomy and comfort.
It really does. It proves that science is finally finding gentle, restorative solutions to intimate pain. The future of treating chronic tissue degradation isn't about overriding the body with synthetic hormones or forcing it to heal through thermal trauma.
It's about providing the exact biological precursors the cells need to heal themselves naturally.
It's giving the accordion its thick, resilient leather back without having to set it on fire first. And that changes the conversation entirely for millions of women who have been told that chronic, intimate pain is just an unavoidable consequence of aging or medication.
Absolutely.
Well, thank you for joining us on this deep dive today. Before we wrap up, I want to leave you with a final sort of mind-bending thought to mull over on your own.
Oh, I'm ready.
If the highly purified DNA fragments extracted from trout gonads can be introduced into human tissue to successfully trick our aging, degraded cells into completely regenerating themselves, what other cross-species biological building blocks are out there in nature just waiting to seamlessly reverse the aging process in the rest of our bodies?
Now that is a fascinating possibility to consider.
Right. Until next time.